So first of all, this is an infectious disease that's spread mostly by droplets. And so anything that we do, anything that we're trying to do to prevent transmission, which is really all we're doing now since we really don't have a vaccine, nor do we have very effective treatments, is to break this chain of transmission. So a lot of the recommendations you're seeing from public health, the physical distancing, the isolation, the way we are screening people, whether they're symptomatic or asymptomatic, the policies about returning to work, basic things like covering your cough and your sneeze, the mask policy that HHS has told us to do, the cleaning and disinfecting surfaces, the PPE, it's all related to just break this chain and really influence this concept of something called R0, which is essentially the ability of the virus in a single person to affect other people. This virus is very new and strange to most of society, but coronaviruses as a family have been around for a while. On the left-hand side is kind of the family tree of coronaviruses. And there's been at least 7 of them that have already, or 6 of them, I should say, that have already infected humans for many years. The yellow ones here are these common coronaviruses, which are considered low pathogenicity. And I bet every single one of you has had one of these already, because these typically cause colds, just common colds, sometimes maybe a little bronchitis, not a big deal. The high pathogenicity ones are more of a recent phenomenon, and these are slightly different looking coronaviruses that probably jumped from other species, which is actually a very common phenomenon in infectious diseases. Tuberculosis, influenza, many other things, HIV, for example, all of these are known to have originated in animals and they jump over into humans. SARS, MERS is another one, and then SARS-CoV-2, all 3 of those probably originated from animals. And then just so we are all on the same page with the terminology, the virus is called SARS-CoV-2 and the disease is called COVID-19, kind of analogous to the way HIV is a virus and then AIDS is kind of the disease. So the first big experience in this virus came in December and January in China. And this is one of the very early reports of who this virus was affecting out of the first 44,000 cases that were reported. And in the blue columns, you can see by age kind of who was getting this virus. And it really is a virus that mostly infects adults. You can see there are just a very few number of kids that were affected below age 19. And then the yellow line is actually the fatality rate. And you've heard this, I'm sure, in the media, that really, if you're above age 60, this virus has a very different and more profound effect on your ability to fight it off and your mortality rate. So just to run through these numbers very quickly, if you're over age 80 and you get this, 15% chance of dying. Over age 70, about a 10% chance of dying. Over age 60, about a 5% chance of dying. And it goes down from there. It doesn't go down completely to 0, but the proportion of 20-year-olds and 30-year-olds that are dying is really, really low. Now, what you don't see on this graph is the contribution of underlying conditions. So if you happen to have diabetes or high blood pressure or lung disease like emphysema or something like bronchitis, your mortality does actually go up closer to about 5%. And the main manifestation of disease here is this really terrible pneumonia that you can see on the bottom right here. This is a cross-section of someone on a CT scan where their lungs are just really filled with this virus and all the inflammation that goes along with it. This is data just to show you this isn't just China, but this is almost exactly the same kind of data through the age bands there in the first 4,000 cases in the US reported in the CDC. So you can see the death is the dark blue bars there and really hard hit in the older population above age 85. In the US, probably because we do have a lot more underlying chronic disease and obesity and diabetes, we did see more deaths and more hospitalizations in the lower age bands, like in the 20s and 40s, as you can see there. And then plenty of hospitalizations in young people in the US as well, but relatively the same trends where you saw higher mortality in those that were older. One very important characteristic of this disease, which should influence everything we do about it, is that there tends to be this lag from when we diagnose cases, which is to say that the yellow bars here represent the first cases that were diagnosed in China. And when they went and asked all these people when their symptoms started, they sort of gave this whole other shadow wave, which is the blue one, which is when their disease actually started. Meaning to say that the cases that you see announced by Wilma Wooten and Eric McDonald are probably about 2 weeks behind what's actually happening in the community. So we have publicly reported cases here in yellow, and then we're actually already behind what's actually going on in the community. And if we look at deaths, we're even another 2 to 3 weeks behind there. So there's kind of this shadow epidemic that's happening out in the community, and then what we're seeing is probably about 14 days behind, which is very important in terms of the actions that we take, because the actions that we take today really won't show an effect until at least 2 weeks from now in the future. So how is this disease transmitted? Well, I'm going to go through this in a traditional way. We think of conventional wisdom being this sort of top left thing, where this is a respiratory droplet transmission, where you have to be sort of within 6 feet of a really sick, symptomatic person to get infected. This virus, we know, latches onto receptors that are eyes. Just see in the bottom there that people generally the virus will just stick in people's eyes, noses, or mouths, and then make their way into the lungs and make people sicker. This is really one of the main reasons behind the policy on mask wearing. So mask wearing does not only protect a person on the left-hand side from acquiring the infection from outside, whether people are coughing on you or just breathing on you, but it also takes a person who's sick and who may be sick before they have symptoms and protects other people around them from getting the virus, getting those droplets. And early on, we didn't really know much about this, and we were only masking people that had symptoms, but it is very, very clear now that masking universally is the right thing to do. You can see some of the numbers there, that different types of masks help in different ways. The most effective, of course, being something like an N95 mask, but even just a homemade tea cloth mask can significantly reduce the amount of particles getting in and getting out. There's a question about whether asymptomatic infection occurs, and this is one of the earliest studies that was literally in people escaping China to Japan on an airplane. And these researchers basically tested everybody. There were only about 60 out of the 565 that were symptomatic. And the bottom line here is that they found disease in all types of people, whether they had symptoms or not. So asymptomatic infection looks like it does actually occur, although you can see from the numbers on the far right that it's a much lower percentage than those that have symptoms. So that was kind of one of the first surprising things, is that you could actually have this and be spreading it around and not have any symptoms at all. I'm going to turn to another study here, which is from one of the hardest hit places in the US early on, which was Seattle. And what you see here on this graph here, and there's sort of days on the x-axis going from -9 all the way through +15, with a red line in the middle being the time at which the person developed symptoms. And what the dots represent is a lot of nasal cultures. They did swabs on these patients. And the red ones mean that they had a positive viral culture. The blue ones mean that they had a negative culture. And I just show you this chart to show you that patients were actually spreading virus and spreading virus around them up to 6 days before they even had symptoms. So this is what we call pre-symptomatic transmission. Everything on the left here in this particular study means this person could have been spreading to their nurse, their caregiver, or the people around them. So number one, asymptomatic infection does occur, and then pre-symptomatic transmission definitely occurs. What about the other end? Once somebody has had the disease already, how infectious are they later on? Well, this is a contact tracing study from Taiwan where they looked at people and tried to trace how many other people they infected subsequently. And I want you to focus really in on the blue line here, which is the number of transmissions that they saw after somebody got better. And it shows that it really drops off pretty quickly by about 7 days. So when you're talking about one of the city or county hotel rooms back into a congregate living setting, or releasing somebody back to a household where there's elderly people or another congregate setting, if you get past 7 days from when the person was symptomatic, you're generally pretty safe. I know the county is struggling with whether to use just time or whether to keep re-swabbing these people or not, but I'm pretty reassured by data like this that means that you don't generally infect other people more than a week past when you've had symptoms. Lots of discussion about how long the virus lives in surfaces and in the air, and this was a pretty controversial study showing that the half-life of the virus on the bottom chart here in aerosols can be up to an hour or so. And then on surfaces, you see, depending on the surface, it can be 1 hour, 3 hours, 6 hours, and up to 8 hours of a half-life, which means that if somebody sneezes or coughs, for example, on a plastic surface, that you could have virus there for hours to days. And the lesson here is that it's not just being around somebody that's sick or somebody that is about to be sick and having them breathe on you or cough on you, but if they actually touch a surface and leave some of the virus there or leave some droplets there, that can very easily transmit as well from hours to days after the fact. So everything I'm showing you is really the data and the evidence behind some of the policies that have been put in place. This one in particular tells us that we got to be sterilizing surfaces. And a lot of the regular cleaning things that we do with industrial cleaning chemicals can pretty much kill SARS no problem. We just have to do it on a regular basis. So this is an interesting chart, which is just visually striking to me. This is run out of Rady Children's Hospital, and what they do is report on all of the different respiratory viruses that they're seeing throughout the entire community of pediatric practices. And you can see the effect that social distancing has on all viruses, not just COVID-19. But look at the drop that happened around end of March, beginning of April. We almost completely eliminated the flu season by just everybody staying at home and not having school. So very, very effective, the general social distancing practices. So I know that was a lot of science, a lot of papers that I just ran through, but the gist of all this literature so far is that asymptomatic infection can occur. Looks like it might be somewhere between 20 and 40%. In people that are symptomatic with this disease, viral shedding peaks probably right before they develop symptoms, which means putting a mask on an asymptomatic person may be doing a lot of good to prevent the spread of infection. And some models suggest that pre-symptomatic transmission accounts for the majority of infections, up to 73%. Looks like people develop immunity after about 7 days, which means that their virus levels fall quickly. And in many studies, there's been no infections after 8 days beyond the onset of symptoms, which makes us reassured about returning people to work. All this literature supports social distancing policies. It supports widespread face coverings, both for those that have symptoms and those that don't, not only to protect you from other people, but protect other people from you. And it really does support many of our PPE policies for those taking care of patients. It also supports the return to work policies from the CDC, which suggests 10 days of rest after symptoms, as well as 72 hours without any symptoms. I'm going to run through just some numbers from San Diego County. This is from the LA Times, which has been tracking San Diego relative to the rest of the state. And what we've generally seen is that the large urban areas have been hardest hit. You can see San Diego's second from the top there. San Diego and Riverside County have been kind of tied for second place, and Los Angeles has been much harder hit. San Francisco is much lower here, but I think it really has to do with population density and when the shelter-in-place lockdowns went into place. San Diego has been maintaining a very nice dashboard of cases, and what you can kind of appreciate from this is that our biggest number of cases, probably 20 to 30% of our cases, are really in the South Bay part of San Diego. As you can see, our hospitals have been getting slowly and gradually fuller. Looking at that ICU number going downwards, as well as the total number, this is data reported to the state. And we haven't had a real overwhelming surge, which is what everybody was afraid of, but our curve has really continued to go up. You know, we're definitely not out of the woods yet. I'd say we're in the plateau kind of part right now. And one more slide on the South Bay surge. This is just illustrating by zip code where the newer cases have been. And you can see in the top, Otay Mesa, Chula Vista, National City, Logan Heights, and El Cajon really have been responsible for the majority of cases that we're seeing really in the last couple of weeks. I'm going to skip through this data because I'm running a little bit behind, just to show you that Family Health Centers has been doing lots and lots of testing, including more public and community-based testing, and we've been seeing positive rates. The red are positive cases, the green are negative tests, and it's just definitely still there at really kind of a steady rate. We're not really beyond the curve at all. Okay, just a couple of slides on clinical aspects, and then I'm almost done. I mentioned this earlier, showing you the curve, just the delay that we're seeing, but just to show it in a single line here, what typically happens is after exposure, it takes about 5 days until somebody develops symptoms. Usually people, once they start to feel ill, on average, it takes them about another week to get into the doctor and get tested. Once somebody gets diagnosed with the disease, there's this kind of grace period, the yellow bar there, where people can feel relatively okay. And then a characteristic part of this disease is people can absolutely crash about a week to 10 days after originally being ill. And this is where things get very dangerous. So in that yellow and red period, this is when we want to get people into the hospital so they can be observed and given oxygen if they need to. So if people are evaluated early on, they might actually look okay. This is a relatively normal looking chest x-ray from early on. But then 7 to 10 days after is when people tend to sort of crash and hit that really, really severe viral pneumonia phase. The disease is mainly a respiratory disease, so we're looking at fever and cough as the main symptoms. That's what was seen in China, that's what we've seen here. And then the course of illness, just to show you a visual, looks like this, where most people are gonna have mild to moderate disease and most people are gonna recover just fine. It's these red arrows that we really are worried about, that certain people, whether they have comorbidities, pre-existing lung disease or heart disease or diabetes, even if they present initially with mild disease, can really have a tough time later on and can die. Just one slide on the fact that this is a disease we don't understand fully yet, and there's all kinds of non-lung findings that are popping up, such as coronavirus being found in the heart muscle of people or in the kidneys, or causing really strange clotting diseases in people's peripheral extremities. Definitely don't understand the disease fully, and it's kind of boggling our mind really quite a bit. Just briefly on treatments, we don't really have any effective treatments. The only one that's been FDA authorized is this one called remdesivir, but that doesn't help most of us because it's only IV, and so you can only really get this in the hospital. Lots of other data on all these other things. I'll mention convalescent plasma, that means taking blood from someone who's survived coronavirus and then infusing it into somebody who's sick with it, as actually looking pretty good, and San Diego's made a major effort to try to get people treated with convalescent plasma. Testing is what I'll finish up with, I think. Very complicated algorithms of who deserves to get tested, but I want to highlight here on the right-hand side that congregate facilities are really a very high priority for testing, including long-term care facilities, homeless shelters, substance abuse treatment facilities, and correctional facilities, mostly because of the obvious, because of what I've told you, that this disease can transmit so easily in crowded settings. This includes people that are asymptomatic as well. So screening through asymptomatic areas to try to find those few people that are asymptomatic and maybe spreading, we think, and I think, is very valuable exercise to prevent a major outbreak in a facility. And I'm going to present to you this, which was published by the CDC, a collection of studies from homeless shelters in Seattle, Boston, San Francisco, and Atlanta. And you can barely kind of see it there, but in the middle column, the number and percent positive, many of these places were finding 30 to 66% of their residents positive already because they were too late. I would much rather be like Atlanta here, where they did a whole sweep of testing and found 4% positive, and were able to take those 4% and isolate them and really prevent an outbreak in a shelter, which is what early testing sweeps do. And we've been really privileged to be involved with the testing at the convention center, as well as our PATH facility, Downtown Connections, and we're now kind of sweeping through other facilities such as the Rescue Mission, House of Metamorphosis, Salvation Army, other places. I think this is really, really important public health work. Very important to know about testing that there's really two different windows depending on the test that we're doing. For the most part, we're talking about virologic testing, which is a swab of the nose to see if there's an active infection at this very moment. And then later on, we're going to sort of get into blood testing, which is for antibodies or for serology. The window is really important. There's only about a sort of 9 or 10 day window in which you can catch a positive virologic test. So it's really important to tell people that a test today means that you're not positive today, but it doesn't mean that you're not positive a week from now, which is why doing a whole sweep through everyone at the convention center is great to find people that are infected right now, but we need to seriously think about doing it again and repeating that type of testing. Serologic or antibody testing is sort of after things have happened to see who's been exposed in the past. And I'm happy to say that in San Diego, there's been a really nice big effort to get our testing volume up really high. The state has estimated that we as a region need to be doing about 5,200 tests per day in order to have a real good sense epidemiologically of what's going on in the county. And we're sort of hovering around that 3,500 to 4,000 range right now. And you can see the purple line is showing that the percentage of tests that are positive is slowly going down, which is actually exactly what we want to see. That's good news. The bad news, unfortunately, is that this orange bar at the bottom is still continuing to hang out around about 100 or 150, which means we're still having about 100 to 150 new cases per day. And if we're doing really good public health, we need to actually call all those people, call all of their contacts, and tell them to continue to isolate and shelter in place, which is going to be very important, especially as we open up society a little bit more.